Hi, this is Dr. Bharadwaj. I am CEO and Homeopathy Doctor at Fidicus Homeopathy. Today we will discuss on one of the important topics, that is, so what happens if you use antibiotics and painkillers as prescribed by allopathic physicians or a corporate hospital or a gynecologist nearby you or Western medicine? What is the problem with that and what advantages you have with homeopathy? We will discuss in topic. So first, before going that, we will slightly look into what is a Bartholin cyst or Bartholin abscess or Bartholinitis. You know that women's vaginal area, on right and left there will be two glands. These are known as Bartholin glands. These glands will open into women's vaginal area through a duct that is known as Bartholin duct. So when this duct get blocked, what happens is this Bartholin cyst or Bartholin gland is filled with fluid and it gets infected. That is known as Bartholin cyst or Bartholin abscess. You can see that this is the normal side of the vagina and this Bartholin gland has obstructed and it has formed into cyst. This will be painful, this will be tender, this will be red, and sometimes women describe this as a very severe pain. Normally what happens is this can be short lived, means you can get this for first time, or some women even suffer with this problem repeatedly multiple times over a period of time. I have seen the women suffering with 20 years, 30 years. Every alternative month or every 2 months they will get this and they will take antibiotics and painkillers, it will go away. Even some women get for first time. What happens is if they take antibiotics and painkillers, there are certain disadvantages. So what are the disadvantages? We will look into this now. This is Bartholin cyst. They have two options: either you have to go with surgery. Surgery is incision and drainage, or you can go with marsupialization surgery. These are the two types of surgery. I will link these videos regarding marsupialization in the description. You can go through that. We have video on that as well. Next one is we will look into what are the disadvantages we have when we use painkillers for Bartholin cyst or Bartholin abscess. First one is very low success rate. What I mean by very low success, why do you go to a doctor and take these painkillers and antibiotics? Ensure that your pain has to reduce now and it should not recur again. But these painkillers and antibiotics are not effective against Bartholin cyst or Bartholin abscess. Very low success rate. There is no success rate for them. And one more thing is recurrence. You have to pay attention here. So recurrence is, so we go to doctor to prevent our disease. Once the disease is cured, it should not come again and again. But if you take antibiotics and painkillers, until you take antibiotics and painkillers, they will reduce. Once you stop them, you will get them again. So that is a main problem with using antibiotics and painkillers, that is reoccurrence. Next one is acute become chronic. See, what happens is when the women is young or when any age women get Bartholin cyst or Bartholin abscess for the first time, if it is not treated with homeopathy or if it is treated with painkillers and antibiotics, what happens is it becomes chronic. Chronic means for a long time. I have seen women where acute has turned into chronic. They have been suffering for more than 25 to 30 years. For 25 to 30 years, every month they will get, or every alternative month, every 2 months they get, and this becomes chronic and this becomes habitual. Whenever they get, they will take painkillers and antibiotics, it will subside and again it will come. So that is the meaning of acute becomes chronic. They will not cure and they will not prevent the disease from occurring again and again. That's the reason you have to consider homeopathy when it is in acute stage, so that it will not become chronic. Next one is chronic and recurring and side effects. So when it becomes chronic, you will get again and again. So every 1 month, every 6 months, it becomes recurring. And there are a lot of side effects when you take painkillers and antibiotics. You know, painkillers have a lot of side effects, like it can be an addiction forming, or it can damage the nerves, it can damage the kidneys, it can damage the liver. So different painkillers have different side effects. Based on the painkiller you are taking, you will have different side effects. Coming to antibiotics, you know the side effect, the main side effects. Instead of killing only the bacteria within the vaginal cyst, it kills useful bacteria. So constantly you will be using antibiotics, and these antibiotics will be killing lot of useful bacteria. You will lose a gut biome and your digestive system is disturbed. And also every time you take you have to increase the antibiotic. So these organisms within your vagina will develop, in the Bartholin cyst will develop antibiotic resistance, so that every time you have to go for a higher antibiotic and you have to use it continuously. It has lot of side effects. And next one is discomfort and anxious. always there will be discomfort. So the some women cannot sit, some women cannot walk, they cannot concentrate on their career. There will be lot of discomfort, pain means there will be continuous pain. And tenderness means when you touch it, it becomes more painful. And also it becomes anxious whenever you want to go to a family function or office function. It becomes anxious, so you are not able to concentrate on the thing you are doing. This discomfort is described by many women. And when the women is young and they are sexually active, there is lot of disappointment and a lot of misunderstanding between the husband and wife, your partner, when you are constantly under the pain. And even you have a lot of discomfort when you have sexual intercourse or whatever the sexual activities you are doing. There will be a lot of pain and discomfort. And coming to side effects, as I have already said, it can damage your liver. There are painkillers which can destroy your liver, and it can destroy your kidneys, nerves. And while using antibiotics, it can reduce your appetite, and it can also cause addictiveness. You can get addicted to the painkillers. There are a lot of things can happen. And coming to the complications, if you are not treating well and not preventing well, there can be cellulitis and sepsis. Cellulitis means local infection spreading to the skin and the tissue around it. And also sepsis means it can go into septic shock, or where the inflammatory mediators are released into entire body, and you can go into sepsis as well. So finally we'll land into surgery. Even surgery will not be effective. So there are different types of surgeries: incision and drainage. If it is not working out, they will go for marsupialization. If it is not working out, they will remove entire gland. Once they remove your entire gland, so this gland is very important for you. So how this gland helps you is it will release some secretions which are lubricating. These secretions do two things. One is they will keep the vagina moist and ensure that there is no bacteria entering into the vagina and there are infections. And one more thing it will be doing is, when you are sexually excited, these fluids will release, and they will help you in lubrication when there is intercourse, so that there will not be any pain and you have the pleasure. When you don't have that gland, what happens is all your intercourse become painful, and it will lead lot of discouragement to your partner and your sexual life. So considering all this, so homeopathy is the best answer. We will now look into how homeopathy can help you in treating Bartholin cyst without painkillers and antibiotics. Coming to homeopathic treatment, how homeopathy can help you in Bartholin cyst or Bartholin abscess without using any painkiller or without using any antibiotic. First one is, once the disease is cured, so you have come to us with Bartholin cyst, maybe it is severe or it is in acute state, or you have already went through surgery, multiple surgeries, you have went through marsupialization, you have went through total removal of the gland, or you have went through incision and drainage. Whatever the case is, we will first cure the disease with the help of medicines. It will completely get cured. Cured means previously how your vaginal area was, it will go back to that space. That is known as cure. The changes which you have that are occurred due to Bartholin cyst or Bartholin abscess will be completely reversed. That is called cure. Once the cure is done, the next thing is prevention. So you have to prevent that Bartholin cyst from coming again and again. So we have seen the women who are suffering with Bartholin cyst for more than 30 years. Every 2 months, every 3 months, every 6 months, they will get this Bartholin cyst, and it will be painful. You can prevent even such kind of recurrences while with the homeopathic treatment. And what is relief? Relief means you have come to us with severe pain. You cannot sit, you cannot stand, you cannot walk, and some women describe it as they want to commit suicide because of that pain. Even that cases, homeopathy is very quick to relieve the pain. Homeopathy is quick to mature the abscess and get the fluid out, so that your pain will reduce immediately. So homeopathy is very effective in that area also. On contrary idea that homeopathy is slow, no, homeopathy is not slow. The cases where the pain has to be relieved quickly, especially like Bartholin cyst, it will do it very quickly. So that's the reason prevent, cure and relieve all are possible with homeopathic treatment. And the best thing is no side effect. Not even single side effect you will have, whether you take for prevention, cure, relieve, or if you want to cure completely, whatever it is, when you take homeopathic treatment, it is 99.999% safe. Some women, rarely out of 1,000 cases, one person can have some side effect. Those are not major side effects. Those are minor side effects. When you change the medicine or when you reduce or increase the dose according to the situation, those will go away. But it is very safe compared to any other system of medicine. And what about the effectiveness? It is very effective. I have treated till now some thousands of cases around the world, US, UK, France, around the world I have treated. The success rate is around 99%. I can say no one went for surgery after coming to me for Bartholin Cyst. One or two people out of these thousands of people went to surgery, that too because they are scared by the words told by the gynecologist. When they go to gynecologist in severe pain, they will say that it has to be operated, there is no other chance. They are afraid and went to surgery. Otherwise, no need to go for surgery. More than 99%, almost all the cases whom I have treated for Bartholin Cyst as was successful. And coming to effectiveness, we can cure completely for 95% of the people. When 100 cases comes to me, if I give medicine for Bartholin Cyst, 95% is permanently cured. Okay, it is prevented, permanently cured. Okay, rest of the 5%, what happens is it can be two outcomes. One is until they use the medicines, Bartholin Cyst will calm down. Once they stop the medicine, it will come again. And for some people, what happens is it will be completely cured. Again, after 1 year, maybe after 6 months, after 2 years, it will recur again. That happens only in 5% of the people. But in 95% of the people, it is completely cured. Once the treatment is done, it will not come again. That is for 95%. Rest 5, they can go into two categories. One, Bartholin Cyst will come down until they use the medicines. Once they stop the medicine, it will come again. For some people, after 3 years or after 6 months, after 2 months, it may recur. It happens only in 5% of the people. That's the reason we say homeopathic treatment is very effective in Bartholin Cyst case and timely. Timely means there is a misnomer that homeopathic treatment is late, it will take time. No. If your symptoms are acute, you have severe pain, you are not able to sit, you are not able to stand, you are not able to go to work. So some women describe it as they want to commit suicide because of the pain. Even in that pain, when you take homeopathic medicines, it will reduce the pain quickly, it will mature the cyst, it will make the opening in the cyst, the pus will come out and the pain will reduce. So homeopathy medicine is safe, effective and timely. Okay, these are the advantages you have in homeopathy for Bartholin's. And coming to the consultation, we offer two types of consultation. One is online consultation and in-person consultation. Through online, wherever you are in the world, you can be in US, UK or Pakistan or any country, you can make an audio call or video call of your choice. If you already shown to a gynecologist, you can share those reports, and if any new reports are needed, you can get them done locally and send it to us. We will ship the medicine to your doorsteps wherever you are in the world. If you are in India, it will take 3 working days normally. If it is rural area, it will take 4 working days. If it is US, it will take 4 working days, and any country other than US, it will take 5 working days for the medicine to reach you. Or else we have multiple branches. You can inquire about the nearest branch. You can come to the branch and you can meet our physicians or doctors. Those are all talented. So, and you can take the medicine. This is our phone number 7997 101 303. Prefix is +91. This is the country code for India. You can WhatsApp us, call us, and you can also see our details on www.fidicus.com. So these are the contact details. Next one is, there are many homeopathy clinics, right? So in every street in India now there is one or two homeopathy clinics. Why you have to prefer Fidicus Homeopathy? Fidicus Homeopathy has highest chance of health. It means we have highest success rate for Bartholin Cyst, and we have transparent treatment based on your condition, whether it is acute, chronic, how many days it is, based on your age. You will give transparent information about the disease and what are all the options you have, and the treatment is transparent. There is no masking of information, nothing. Whatever we are doing, will give entire information to you, and we have personal care. It is not that everything is AI and everything has become mechanical. So personal care, our doctors will identify you, our staff will identify you, and they personally take care of you. It is not that when you call it, it goes into IVR system and IWR system, you have to deal with the system. No, we have tried to put as manual process as possible in dealing with the patients. But back end we are doing using technology, but in front end you can just directly call us. By the time you call, our people can identify you and guide you even before you are describing your problems. Okay, so this is a personal gain. That's the reason you have to consider Fidicus Homeopathy. We have highest success rate compared to any other homeopathic individual doctor or a corporate hospital for Bartholin Cyst. Thank you.